Welcome to the Libman Education Coding Clinic for ICD-10 CM and PCS Update, third quarter 2018. My name is Barry Libman. I will be leading us through today's review of this issue of Coding Clinic. Next, we explore the coding of a DIEP Flap Breast Reconstruction, DIEP, which stands for Deep Inferior Epigastric Artery Perforator Flap Breast Reconstruction. The question and answer address a rather complex clinical circumstance. A patient who is status post a right mastectomy as treatment of breast cancer is admitted for prophylactic left mastectomy and a bilateral deep inferior epigastric artery perforator flap reconstruction. So here, the remaining breast is resected and bilaterally flap reconstruction is performed. In contrast to the tram procedures, which involve muscle reconstruction, DIEP surgery involves harvesting skin and subcutaneous tissue from the lower abdomen to replace the surgically removed breast or breasts. In this instance, following a left mastectomy, DIEP flap tissue was used to replace the surgically removed breast, and blood vessels were anastomosed to maintain the blood flow. On the right side, the previously placed tissue expander was removed and the DIEP flap was placed in the same manner. The questions are, how should this procedure be coded? Is the graft excision separately coded? And is the mastectomy coded, or is it inherent in the replacement procedure? Coding Clinic instructs us to use these three codes to report this procedure described. One code for the resection of the left breast, open, the mastectomy, and one code to report the removal of the tissue expander from the right breast prior to performing the DIEP on that side. Coding Clinic has drawn a lot of attention with two specific bits of explanation that go along with these code recommendations. The first is that Coding Clinic instructs not to code the harvesting of the graft for the DIEP separately, as this information would not add value to the coded data. Coding Clinic also states that the mastectomy done as part of a reconstruction procedure is coded in this instance because the primary objective of the surgery is to remove the cancerous or potentially cancerous breast tissue, and that the reconstruction is an additional objective. I would expect that down the road we will hear more about this recommended coding guidance. Many coding professionals feel that this advice is a departure from the hierarchy of guidance that we discussed at the outset of the presentation. Let's take a look step by step.